So some interesting things in your case, right? That is different than maybe some other cases. Everybody has a different breast positioning. In your case, the left side is way lower than the right side, right? And I'll show you some markings that kind of illustrate that a little bit better. We can change, and some things we can't. Like, some things are genetic, and some things are just, you know, positional. But if we look at the folds of the breast, the folds are always something that are fixed. We can't really do much about. And if you look in the mirror, you're going to notice that this one is lower and this one is higher. And that asymmetry in position is what really causes things to be different.
Okay.
So as much as I want them to be the same, it's really hard when they're genetically off.
Okay.
Right?
Yeah.
So we're gonna make adjustments as much as we can to make them look better, make them look more symmetric. One thing we're gonna do for sure is the areolas, right?
Like make them smaller?
Yeah.
Yeah.
You're gonna be super happy with that.
Okay.
It's gonna make a big difference with the areolas.
Yeah.
So that's also gonna make a big difference. So I always tell patients, we're not trying to make 100% improvements. We're trying to make like 80% improvements. And that's just life, right? Like nothing's 100%, but we get as close as we can to achieving a better look. Now, how much do you want for volume? Like, what is your interest there?
I can't remember what we put. I have a feeling in my head.
Perfect.
What was I saying? I just want like a full D, and that I don't look unproportionate. You know, that it goes with my body. So I know it also depends on like my chest, and so you know. I just.
But you're comfortable with this size, or you want bigger than this size?
If it's a little bigger, would I look unproportionate?
I don't
like,
think so.
You know,
I
just want like I never had like the cleavage.
Yeah.
I want the top.
Right. That's I think that is your Achilles heel. Like that's the hardest part in this case. Partly because, again, I'll show you an example of why. But
okay.
When you look in the mirror, if I draw this in a different color, it'll stand out more. Watch. So starting from about here, this is your sternum. This is your rib, and then it ends in a little piece of cartilage here at the bottom. The amount of gap that you have between the breasts is genetic.
Yeah.
So everyone has a different cleavage separation.
Okay.
Like some women only have one finger. You have two fingers. I have women that have 3 fingers.
Okay.
It just depends on the genetic component. So I want them to be closer as well. But if I start to dissect closer and closer to this midline, we risk the skin popping out and then doing what we call a symastia, where it pops forward and it's like a uniball.
Oh yeah, no, I kind of meant like cleavage on top.
And on
like,
top,
the like this, I don't mind it. It's more
on
like
top. We're gonna try our best to see how much you're always gonna have more on top here than you are here.
Okay.
The reason, again, it comes down to the folds.
Yeah.
Placement. So turn sideways for me. Yeah. Now we're gonna check and see, get an idea of your nipple positioning, where it should be basically. Okay, turn forward for me. Yeah. So your nipple should be at least a few centimeters higher than what it is now. Tell me, you're gonna say something?
Me?
Yeah?
No.
Cool.
No, just listen.
All right. Again, we talk about nipple positioning. We also, have to discuss the not placing the areolas too high. If you place them too high, then it looks weird, right?
Yeah.
So we're like in a battle between lifting and filling, and too high and too low, and so it's always an interesting dynamic. But yeah, this is going to be a major improvement here with the areola position for sure. So what we're gonna do now, in a second when I finish drawing this, so we're gonna draw the vertical vertical limbs of this breast lift. Let's see. Okay, so you're gonna open your arms a little bit, and you're gonna stay really still. I'm gonna pull you side to side, but just stay where you are. Here we go. This is kind of our rough estimate of how much extra skin that you have that we're gonna take out. So now we're going to measure all the limbs that I drew, and then we'll start talking about the tummy tuck in a second. Try to keep that incision under the bottom very short so that it hides, so nobody can see it underneath the bottom. Okay, so good. We have our breast designed. We're drawing the midline here. What I'm noticing in your case, how many pregnancies have you had?
2.
Yeah. So if you look into the mirror, you're gonna see that your belly button is off to the side, instead of being like in the midline, and that happens with pregnancy a lot. So we're gonna move it back to the middle. And then we're gonna fix all the muscles. If I were to really push on you hard, I can feel the gap. You have a big muscular diastasis. So we're gonna fix that. You're super slim, and you know, you're not a heavy set person. So we're gonna be able to get a really good result and take off all of the extra skin that you have here. We're gonna take all of it off. We always do liposuction of the sides or the flanks to get you a better waistline also. But what I want you to do now is put your hands together, like your fingertips, and then go all the way down, and then pull all that skin really tight up. Yes. So we're gonna go below your C-section line. And the tighter you pull, the flatter everything is gonna be. Yes,
Let me pull.
exactly. So we're gonna make it really low bikini, like it's much lower than your C-section. So we're not going to ask you to do any heavy lifting for about 6 weeks. That's really important for the recovery. It's similar to the C-section. Like, you know, after C-sections, you're not supposed to lift any heavy weight either for about 6 weeks. So the instructions are very similar to C-section. So again, I'm going to draw the whole pattern here, the whole marking, but I'm not going to end up using my whole marking for you in terms of the incision. I just don't want to leave you with a dog ear on the sides. So I'm gonna do everything that I can to avoid the dog ear.
You do that. I don't mind the scar.
Perfect. Turn all the way around and we finish my drawing from here. And then we're gonna see what else that we have for the plan for today. What else do we have there?
Nope, that's it. So it's going to fix on the abdominoplasty, breast implant exchange with capsulectomy, breast lift, like all the blanks, and then the add-ons.
Okay, awesome. Okay, so again, I'm not gonna go back here, but I like to keep everything drawn and symmetric. Okay, and you've opted to use all of the great add-ons. So we're gonna do the Previna, we're gonna do the pain package, the Artis, and then you have the insurance program with the Stetisure. So very smart patient, very smart, very smart.